In this presentation, I'm going to talk through an example of coding. Here is an example of a coded transcript from a study that explored the views of a range of NHS staff on the provision of outpatient paediatric care closer to home in community settings. This piece of text is from an interview with a GP who was talking about how moving care out of hospitals and into primary care could help to facilitate the exchange of information between patients and healthcare professionals. The person coding the data has underlined parts of the interview that they felt were worth coding or noting. The underlined text has then been labelled in the left-hand margin, so there are 6 ideas or codes on the left-hand side that range from professional role through to technology. So taking the code technology as an example, a reference the GP made to the IT setup and the importance of consultants having access to patient notes remotely in primary care has been underlined. The right-hand margin has been used to record more detailed notes and ideas. For example, questions to bear in mind as more interview transcripts were analysed. So in relation to technology, a note has been made that IT systems affect the quality of care, which is an idea that could be explored further when analysing interviews with other stakeholders. Okay, so going on to stage 3 of thematic analysis, grouping codes into themes. Having been through and annotated your transcripts, you may end up with lots and lots of codes, so it would be useful to group the codes you have into a much shorter, more manageable set of themes. So how do you refine codes into themes? You could group similar codes under one label. For example, anything relating to patient-centered care could be brought together. Then you need to decide on the most important codes or major themes. Here, it is a good idea to return to the purpose of your evaluation and prioritise the main ideas that you would want to focus on in your report. Then, select emblematic quotes from your interviews for each theme. It wouldn't be applicable to all evaluations, but you might want to think about quotes that illustrate barriers and facilitators in relation to each theme. So it could be the barriers and facilitators to delivering patient-centered care, for example. It is worth noting that different individuals might highlight different text or interpret the same text in different ways when analysing data, so discussing your reasoning with colleagues helps. Stage 4 involves charting or tabulating the data you have for each theme. Here is an example of data that has been charted from the GP study described before. Along the left-hand side are the interviewees or stakeholders, and then along the top are the key themes that have been selected. The boxes in the middle contain quotations from each interview that the person coding the data thinks is good evidence of each theme. A reason for tabulating the data like this is that it allows you to see whether the same theme is applicable to all of your stakeholders, and with regard to the same theme, such as patient-centered care, whether the views of service managers you've interviewed differ from those of consultants, for example.